Hello, my name is Jason. I'm the nurse. I just want to ask, what do you want to see in your management plan?
Jason, I just really want to go home. I want to get back into the community and I just want to be in my home environment.
Okay, we will discuss what you want in the interprofessional team and we'll try our best to cater a management plan for you.
In today's case conference, we have 84-year-old Muriel Finn, who was admitted 6 hours ago after a fall at home and having sustained a head injury. Firstly, I'd like to go to our resident pharmacist and talk about her medication charts. Do you have any concerns?
Yeah, so I did pick up on a few things that needed to be changed. She is taking temazepam at night and also paracetamol and codeine.
Yep.
And I do believe that the oversedation of those two medications is actually what led to her fall.
Okay. And I've noticed that she's taking warfarin alongside aspirin. Do you think perhaps she should be taking the aspirin?
I definitely do think that, yeah. But the warfarin is appropriate in this case.
Alrighty. So you're her oral health therapist, and regarding her case today, what concerns do you have?
My main concern is the side effects of the medication, which is xerostomia, which is dry mouth. She's going to have an inability to masticate food, which she can't swallow it properly. Her saliva is not going to be the best. So what I'll do is I'll have a saliva examination, and if it is a saliva problem, I'll recommend a biotin wash twice a day, just for increasing oral clearance. And if it's not, then I'd recommend it to a speech pathologist if there's anything else. Also, it's going to increase her risk of caries, which is a very big issue as well.
I've been discussing with the pharmacologist about perhaps considering bisphosphonates for her osteoporosis. What's your take on that?
There's also other side effects from bisphosphonates on the oral area. So what I would recommend is giving dental treatment such as gum for gum disease, dental decay, or even denture adjustments before she starts the bisphosphonate treatment in order to optimize her bisphosphonate treatment and her dental treatment. It's probably the best thing for the patient.
So as physiologist, I'd like to also get your take regarding this case.
Yep, so ideally we'd like to address her concern about her hip range of motion and strength from her total hip replacement. So that would actually affect her gait as well as her balance, which would be an increased risk of another fall. Okay, so we'd want to address these factors and assess them so that we can therefore create an exercise prescription for her. In the exercise prescription, we'd want to include some balance exercises to help with her ability to adjust to a slip or a trip that may occur. We would want to incorporate some gait training to be sure that she'd be able to walk more functionally, as well as incorporating her reliance on her walking stick, whether she can use it, whether she can walk with or without it. And we'd also want to include some basic lower limb strength, just to make sure that those lower limb muscles and those major muscle groups are working fine. So we'd progress from using bands, whether it start from sitting down or laying down, and then we'd slowly progress that and work that forward. So this would all help in terms of introducing her to prevent further risk of falls.
Okay. So you're an occupational therapist. Regarding this case, what's your take?
So I think we need to do some functional assessments while she's in hospital, definitely a toileting and shower assessment to determine if she's going to be safe to go home.
Yep.
She also will need some services put in place to help her access the community and just for general self-care and domestics in her home environment. I'd also recommend a at-home rehab program. She's really determined to get out of hospital, so we will put a OT and physio in place at home so she can get her confidence back.
Okay. And lastly, we have her home care nurse.
Yeah.
What are your concerns regarding her situation and her case?
So in her case, it's actually good for her to go to nursing home, but the family and her, she's very eager to stay at home. So to allow that, we need some healthcare services in place. And as the OT and exercise physiology have put in place to fix her mobility in terms of range of motion and all that, so I'm happy with that. Another concern I have is her medication. she has been very forgetful about her medication, so having a Webster pack in place would be good.
Yeah.
Also, she has been eating very little and have been losing appetite, as well as her dentures not being adjusted. So I think we should include a dietitian in the team so that we can address that issue. Socially, she has been very active, but due to her mobility, she has been losing social interactions. So having a social worker and also helping her mobility would be good to integrate her back into the community.
Sounds good. I'll get back to the patient, explain to her the next steps, and I look forward to seeing this case through.
Okay.